A very good evening and warm welcome, everyone. I, Dr. 𝗙𝗥𝗢𝗠, on behalf of Voice of Healthcare, welcomes all the speakers and the viewers who have joined in for today's discussion. Voice of Healthcare, along with our supporting partner Pfizer, has taken an initiative to bring together the experts and speakers to recognize National Renal Cancer Action Day. Today's panel discussion will provide a platform for experts to share their knowledge and experiences as well as to discuss the challenges and opportunities that exist in the field of renal cancer research and treatment. We hope that by bringing together diverse perspectives and expertise, we can create a more comprehensive understanding of renal cancer and develop new strategies for addressing this important public health challenge. So, without further ado, let's get started with the introduction of our esteemed panelists. I welcome Ms. Urvashi Prasad, Director, Office of Vice Chairman, NITI Aayog, Government of India. Welcome, Ms. Prasad.
Thank you.
Dr. Vineet Talwar, Director, Department of Medical Oncology, Rajiv Gandhi Cancer Institute, Delhi. Welcome, Dr. Talwar.
Thank you, madam.
Dr. Yuvaraja TB, Head Robotic Surgery Consultant, Surgical Uro-Oncology, Kokilaben Dhirubhai Ambani Hospital and Research Center, Mumbai. Welcome, Dr. Yuvaraja. Ms. Jyotsna Govil, Chairman, Indian Cancer Society, New Delhi. Welcome, Ms. Govil.
Thank you.
So, starting with our discussion, I would like to ask Ms. Urvashi, ma'am, how can we improve access to healthcare for individuals who are at risk for renal cancer, particularly those who may not have the resources to seek out preventive care?
Thank you. Thank you for that question. I think, renal cancer, even before we talk of that, I think, in general, when we look at preventive aspects, we have to look at how we can promote good renal health and create awareness about that, because this is something which can be quite specific for a lay person. They might not really be aware a lot about why renal health is so crucial. What are the repercussions if something goes wrong, what are the kinds of risk factors which are there. So I think the awareness about something like this, because it is perhaps much more specific and not as widely talked about as maybe some other health issues. I think there's a very big role there to sort of create more awareness about this, especially in younger people, because even if you see something like renal cancer across the world, and this is true for many other cancers as well, but definitely true for renal cancer, that while it would be people who are older, generally across the world, who are getting diagnosed in India, we're now finding younger people, and of course a lot of these people are people who already have advanced symptoms of the disease. So I think those are two very important aspects that we need to be able to identify these people early on, and of course some of the symptoms of renal cancer might be non-specific, and so those might be more difficult to pick up, and there might be other more specific symptoms like blood in the urine, or there might be a mass in the abdomen and so on. So I think it's very important that we create awareness both amongst the public at large, citizens at large, but also within the health system, healthcare workers at different levels of the health system, including in primary care, when you are generally not looking out, for such issues, to at least be aware that, if someone is showing up with any such symptoms, which could potentially be a sign or could be a sign of something worrying, then they are at least referred, to the next level of care and to the appropriate level of care, and specialist or whoever they might require. So I think that awareness and that training needs to happen within the health system as well, at all levels, and because we don't have enough specialists, we don't need specialists at every level to tackle something like this. But the general health workers, the different cadres should at least be aware That is something which is very, very important. And then, of course, when it comes to treatment, we do have insurance programs and so on. But I think before we even get to that level, it's really important to emphasize on the prevention, the awareness, making people aware of the risk factors, whether it's obesity or smoking or various other lifestyle risk factors apart from environmental hazards which can actually contribute to renal cancer, and then building the capacity within the health system to actually not only promote prevention and good renal health, but also to be able to aid early detection. I think that is really the focus that we have to ensure at the policy level at least. Yes, thank you.
Thank you so much, Ms. Surushi. As you have said, that awareness and identification of the person who is had risk for renal cancer should be done at first hand. So, moving on to that identification, I would like to ask Dr. Vineet Talwar, sir, what are the most common symptoms of renal cancer, and how can patient recognize and seek medical attentions for these symptoms?
Uh, Thank you, madam. At the outset, there are no defined signs and symptoms of renal cancer. That is the caveat. You know, the signs and symptoms might mirror the normal symptoms which you have because of a non-malignant disease. Having said that, in renal cancer, you have signs and symptoms pertaining to the kidney per se, where the disease starts. The symptoms can be because of the spread of the cancer to the various parts of the body. So, if you look at the kidney per se, then symptoms can be as vague as blood pressure, rising blood pressure. There can be a dull aching pain which might be nagging at the side, on the side of the cancer, or just a heaviness which is persisting despite taking any standard treatment. Or you can have hematuria, that is bleeding in the urine, if it comes in contact with the blood vessel. So these three things can be pertaining to the problem if it is localized to the liver, to the kidney. Now we know that this disease can spread to the other parts of the body. So depending upon the spread to the other parts of the body, for instance, if it goes to the bones, say the spine, then the patient may have pain in the spine. If it goes into the lungs, the patient may have breathlessness along with the uh, parent problem. If it goes to the liver, the patient can have jaundice. So the signs and symptoms are not specific. You have to sift out by using your clinical acumen and judgment as to how to proceed and where to proceed. When a person comes to you with a pain in the abdomen, that necessarily does not mean that that person has kidney cancer. You give the standard treatment, you treat the patient with the normal painkillers or antibiotics or whatever your clinical suspicion is at that point of time. And if you feel that this keeps on persisting for the next 3 to 4 weeks and it is not getting settled, then there is a high index of suspicion that is this something else apart from the routine back pain or routine blood pressure. That is the time when you should take a deep dive, and because of the high index of suspicion, try to go to the root of the problem, and you might find that these patients might be having kidney cancer. And sometimes it might be as innocuous as only fever of unknown origin. You might do all kind of blood culture tests, you might do all kind of infective parameters, you find that it's not there. And whenever you do a scan, say a CT scan of the abdomen, and lo and behold, you find that there is a small lesion sitting there in the kidney which is causing the fever. So the symptomatologies can be diverse pertaining to the site, that is the kidney, and the areas where it gets spread all over the body.
Thank you so much, Dr. Talwar, for elaborating all the signs and symptoms that are associated. There are no early signs for these, but I think we should look out for any symptoms that we are having in our body, whether it be abdomen pain or hematuria and anything, and we should get get it tested through a doctor. So yeah. So, moving on to Ms. Urvashi Prasad, ma'am, how can the government collaborate with healthcare providers and organizations to promote better outcomes for patients with renal cancer?
Yeah, so like I touched upon that, prevention is one very big area, very important area, and prevention is really all about, or largely about, promoting a healthy lifestyle, which is of course relevant, not just for kidney cancer, but in general, right? For a range of health issues and a range of different types of cancers. So I think prevention, promotion of healthy lifestyle, where we can. So at least things like obesity, making sure you are exercising, smoking. Again, it's a big risk factor for all types of cancers as much as it is for kidney cancer. And so I think these are things which you are in your control, which you can avoid. There's also a lot of research on environmental sort of pollutants, which might also be contributing to this. You may or may not always be able to avoid that, but it's important to be aware. Occupational exposures, for instance, to certain chemicals or harmful substances. So I think creating that level of awareness, that is one thing which anyway I think is not possible for a government, any government, to do on its own. So that is a very, very big avenue, where collaboration with other stakeholders, especially civil society, and community based organizations, becomes very, very crucial. But as I said, it's also to build capacity within the health system, because unfortunately not everybody, their first interface with the health system will be with somebody who is necessarily a qualified clinician. We know that we anyway have a shortage of doctors, specialists. We have a very inequitable distribution, and we also need to make better use of other cadres of health professionals that we do have. So it's, I think this is another very important area that we need to build capacity. Was being mentioned, that something like kidney cancer, you might have very non specific symptoms. You might not even have something which is very specific to tell you that this might be the case. So what do you even do with such a case? If such a case presents to you, what do you actually do? And such a person might present to you at any level of the health system, right? So I think that capacity building across cadres of health providers is really very important, especially given the shortage we have and the inequitable distribution we have of specialists. So I think that is another very important area. And I think also, research and innovation, since you also touched upon that at the beginning, we do need better research and innovation to have, whether it is for screening, whether it is diagnosis, whether it is actually treatment options, to come up with more cost effective options, to come up with options which are more customized to the needs of our population. And the needs of our population are very diverse and very varied, and very challenging at times. So we need that kind of thing, something like renal cancer or even other types of cancers. Are we still really able to screen for these in some sort of relatively cost effective, simple way? It is still not possible for us. We're still not doing this at the kind of scale that perhaps we need to or might need to in the future. So I think research and innovation is another very important area where it's not just government but also private sector. We need to get this kind of collaboration so that we come up with new and innovative screening approaches, diagnostics, which are actually suited to the needs of our patients. So I think these are some of the avenues which I think are really very important, when it comes to collaboration among stakeholders.
Thank you so much, Ms. Urvashi. You have mentioned the importance. You have touched upon three important topics, that is the awareness, second is capacity building, and third one is research and innovation according to our population needs. So for prevention, I would like to ask Dr. Yuvaraja, sir, what role do nutrition and lifestyle factors play in prevention and treatment of renal cancer, and how can patient make changes to improve their outcomes? You able to hear me, sir? Dr. Yuvaraja?
Can you hear me?
Yes, sir. I am able to hear you.
Yeah, okay. So now can you hear me?
Yes, yes, sir. We can hear you.
Oh, okay. So dietary measures, so I think it's very pertinent for all type of cancer in general, and especially for kidney cancer. Although there is not a specific diet which is been advocated for kidney cancer, either for prevention or for treatment, but good eating habits are very vital to maintain the healthy body. I think that is true for every disease of our body, and also to manage the side effects of cancer. So especially when you are living with kidney cancer, so eat the what you eat is very important, and it impacts how you feel on day to day basis. That is very very critical as far as the cancer treatment goes. Although the majority of us as clinicians, we know that it is very important. We refer them to a dietitian where it may be a common dietic advice which they give it. I think as physicians we should at least have a basic.
I think we have lost you, Dr. Yuvaraja. We are not able to hear you. There is some connectivity issue.
Yeah, I think I am hearing properly.
Yeah, now it is fine. Yeah.
Fine. So this is how you the food rich in fibers, antioxidants, and then avoiding excessive salt intake. I think nowadays what has happened is that we eat erratically. So we know that the cancer is increasing. Most often it is attributed to diet, although we cannot directly prove the diet is the cause of cancer. But we know that urbanization and having foods which are not traditionally made, so we are suffering because of that. And these are the most important features a patient should, especially the patient with kidney cancer, should not have excessive salt intake and should not have excessive protein intake, especially non-vegetarian food and food and protein supplements. All those things should be avoided, and that is true for prevention as well as for the treatment. So, however, I think diet plays an important role. Although one type of diet cannot be told, we can only take this type of. So, generally what I do is that so I advise them a vegetarian green leafy vegetable and a normal food which is made cooked at home, and also to maintain the weight of the patient. So weight reduction is a very important, and completely three things should be avoided is no to alcohol, smoking, and tobacco in any form. So these three things are very vital as far as lifestyles and eating habits concerned. Thank you so much.
Thank you so much, Dr. Yuvaraja, for touching upon the important aspects of nutrition and diet that plays in the prevention of renal cancer, not just renal cancer, any type of cancer for that matter. So, moving on to the patient accessibility, resources accessibility, Miss Jyotsna Govil, I would like to ask you, ma'am, what resources are available to patients with renal cancer and their families, and how can we ensure that they are easily accessible?
Ritika, I think this is an area which needs a lot of beefing up. I was delighted to hear Urvashi talk about renal disease and then renal cancer, because I think if we can get information out there about renal disease, it'll be easier to get back to the point of renal cancers. Now, as far as we are concerned, we always suggest that in all our awareness talks that people should know what is normal for them. If they do not know their bodies, if they do not know how their bodies function in the normal, healthy state, they will not detect the early changes that come with any cancer, also with renal cancer. Whether it is pain in the back or whether it is, uh, you know, a lack of appetite, a weight loss, people take it as part of the game, par for the course, and they do not think it is abnormal. So it is necessary that they should know that what is normal for them. Yes, blood in the urine is easy to spot, but pain in the back, I mean, I think 90% of women over the age of 50 will talk about pain in the back. I've seen many men over 50, you know, especially those with large bellies, who also have pain in the back. So they should know what is the normal uh, pain in the back and what is different about this one. Obesity, high blood pressure, family history, all these are also part of the uh, signs and symptoms, the risk factors, rather, sorry, for kidney cancer. And also, I think that what is less well known is that long term dialysis also leads to kidney cancer. In some of the literature that I've been reading, it says up to 5 times more uh, possible that you can get a kidney cancer after long term dialysis. Now, in the general population, people know about diabetes, they know about dialysis, but they do not connect the dots. So, if, as Dr. Yuvaraja has been saying, diet is very important, let's start with diabetes. That we control diabetes and therefore we control blood pressure and we control cholesterol uh, swings. So that in itself will create a kind of a kavach, if that is the word I can use, to protect against kidney disease and kidney cancer. As to what are the, you asked me what are the resources. The resources are very few. Even what the government has been saying, and I know that Urvashi is a very concerned government servant, but by and large, in the primary health centers, in the mohalla clinics, what are the resources available to the public? There's not even a pamphlet there with any information on it. And she's quite right. The government cannot do it alone. So it is civil society organizations like ours that need to step in. I have to confess that we are not doing enough either. But the fact is that we need now to step up whatever information services we have and augment what the government is doing. The these big ads of DAVP in the papers, I wish they could be disease oriented rather than politician oriented. I hope somebody agrees with me on that. As for building capacity, we need to educate the general practitioners, the ANMs, the health and wellness centers. It is the base that has to be strengthened before we start strengthening the specialty hospitals and the oncologists. They are already doing a great job. I think that is where I would put my emphasis. Thank you.
Thank you so much, Ms. Govil. You have rightly mentioned that we each need to do our parts right. The government, the patient advocacy groups, and the healthcare settings that are available, that are there. So we all need to do our part to raise awareness or create awareness regarding any type of cancer, renal cancer for that matter. So yes. So we talked about the vague symptoms of renal cancer. Dr. Talwar, I would like to ask you, sir, what are the current limitations of treatment for renal cancer, and what research is being conducted to develop new and more effective therapies?
Thank you, Dr. Ritika. The treatment in renal cancer is quite in contrast to the conventional treatment modalities which we involve in the treatment of the other cancers like breast cancer or lung cancer or uh, cancer of any other part of the body. Uh, what I actually mean is that we don't use or we don't employ the the current chemotherapy protocols when we go about treating patients with the renal cancer. What we are doing nowadays is we are using targeted therapies, and recently we have added the immunotherapies, the protocols, uh, along with either in combination with targeted therapies or alone in the treatment. Now, the obvious question you would ask me is what is the difference between chemotherapy, targeted therapy, and immunotherapy? Well, chemotherapy is, you are using a machine gun and you are hitting at the target and hoping that you will achieve hitting the target and destroying it. Targeted therapy is that you have a very well defined target in front of you and you are very near to it and you can hit it with precision and cause minimum side effects. Immunotherapy is that you charge up the immune system, which is already present in anybody's body, to such a great extent that it comes and overwhelms the cancer. So, we are using the targeted therapies and the immunotherapies at present. Initially, if you go back, say about 15 years back, we used to use targeted therapies. These are in form of tablets. So tablets were given, and what they used to do was they used to block the blood supply to the cancer tissue. So the cancer tissue used to get atrophied or it used to get destroyed. With immunotherapy, what we are doing is we are trying to use the body's immune system and kill those cancer cells. So either we use the targeted therapies alone, which was earlier. Now what we are doing is we are adding the targeted therapies and immunotherapies in tandem to get a greater cell kill. So initially, if we used to treat 100 patients, we used to get success, complete response in about say 4 or 5%. Now we are able to achieve in about 15 to 20% when we use targeted therapies and immunotherapies. But a word of caution is when we talk of actual treatment, this is in advanced renal cancer patients, meaning thereby they are the stage 4 cancer patients in which we use these targeted therapies and immunotherapies. And studies are going on, and there is a lot of progress now where we are using these immunotherapies in non stage 4 areas where the disease is located only in the kidney and not spread out. So we are making a lot of forays, and in times to come, there is another therapy which is known as CAR T cell therapy, which you must have read in the papers. So, lot of armamentariums, lot of choices, and we have to use them judiciously. Cost is a major factor, is as Madam Govil said. In India is a very price sensitive market. The targeted therapies, which were initially imported drugs, now they are freely available generic drugs, so they are very much within the reach. Immunotherapies, unfortunately, because of the intellectual property rights, we cannot have the Indian generics, so the cost remains a major concern, although they have patient assistance plans. So wherever cost is a major issue, we definitely treat with the targeted therapies. But wherever the patient is reimbursed in one form or the other, or the patient can have a patient assistance plan, we add the targeted therapies to the immunotherapies to get the maximum cell kill. Thank you.
Thank you so much, Dr. Talwar, for wonderfully explaining all the therapies that are available currently and their impact on different stages of cancer. So, moving on to that, Dr. Yuvaraja, sir, how do genetic factors impact the risk of developing renal cell cancer, and what role does genetic testing play in the diagnosis and treatment of disease?
Hello.
Yes, Dr. Yuvaraja. Should I repeat the
Yeah,
question?
I repeat it. Your voice got disconnected.
Okay, sir. So, how do genetic factors impact the risk of developing renal cancer, and what role does genetic testing play in the diagnosis and treatment of the disease?
Yeah, I think genetic workup of the patient of a kidney cancer is very important nowadays. Can you hear me?
Yes, yes, perfectly. We can hear you.
Okay. So around 5% of kidney cancer has been, related to the genetic hereditary form. Although it's known as hereditary kidney cancer, and the hereditary syndrome generally have a sign, symptoms, or condition that occur together. So we have, well-defined three syndromes. In fact, four syndromes associated with kidney cancer. So one is VHL, what we call as Van Hippel-Lindau disease. Another is hereditary leiomyomatoma and renal cancer. And another is Brie-Dark-Dubé syndrome and hereditary papillary renal cancer. These four cancer hereditary syndromes have been labeled as hereditary cancers for kidney cancer. So of late, we know that we have a lot of generation sequencing we have been doing for many cancers, including kidney cancer, to identify. Uh, Hello, can you hear me?
Yes, sir. We can hear you.
Yeah. Okay. So to identify this hereditary panel, hereditary cancers, we are doing a lot of genetic tests nowadays. And one thing we should remember: when the patient has renal cancer, they have tendency to develop other cancers. They are linked to um, brain tumors, they are linked to colonic cancers, and they are linked to many other tumors. So especially in VHL, we have pancreatic tumor, or all these things we have to search for that. When you come to hereditary basis of these cancers, the one thing we should be telling the patient is that doing a genetic test will not, it is not, we are not going to prevent that. So it is just to know what the map, we can further, we can concentrate on the people. If they're carrying the same gene, we have to do the repeated test to identify and they diagnose them quite early, so that we can treat them better. So sometimes it happens that many people just jump in to get a genetic test thinking that there is some treatment will be given so I can prevent my cancer. So that is the main important. So before doing any genetic analysis or gene analysis, or explaining anything, so that we have to do what is called as genetic counseling to the patients and the relatives. Otherwise, it is a very it is like, always I tell these patients, it's like having a kundli to you can't change it, and you will be throughout life, you'll be under under the sword, thinking that you'll have cancer. You decide whether you want to do it or not. Once you do it, what are the advantages, we explain to them. I think nowadays, many cancers have been linked to the genetic, hereditary cause. I think this is one of them. Thank you.
Thank you so much, Dr. Yuvaraja. You have mentioned about the genetic testing being done. So, is it readily available in India, or is there any criteria for that to get
No,
it
the
done?
criteria is that any tumor in kidney cancer, generally we do it. Suppose if there is a 1 degree relative having kidney similar tumor, or related to something like colonic tumor, or even a prostate cancer, then we'd ask them to get a first degree relative. Second criteria is that if the same patient has multiple tumors, either one kidney or both the kidneys, we get the genetic analysis and a hereditary panel done. Before doing so, we explain to the patients what are the implications, pros and cons. And the tests are easily available nowadays thanks to next generation sequencing. And the cost is also not huge. It's around say 30,000-40,000 rupees, and there are multiple companies, and they do a hereditary complete panel which includes almost all the cancers together. So I think we are okay with that.
Thank you so much, Dr. Raja, for very nicely and very insightful, explaining that role of genetics in renal cell cancer, sir. So, moving on to Miss Govil, ma'am, what impact does social media and other digital platforms have on patient support groups, and how can these tools be leveraged to increase awareness, engagement, and advocacy efforts?
Ritika, the range of social media platforms is huge. So it is necessary that we identify our audience and use the appropriate social media. Not everybody is on Facebook, Twitter, Instagram, although that population is increasing, especially among the young. But a kidney cancer affects older people and they are less likely to be using these platforms. So, therefore, using radio, the very simple All India radio spots, just a few minutes, say 8 or 9 minutes of talking someone through that could make a much better impact, particularly since the range of radio is far excessive to most of the other social media platforms. Uh, the social media platforms are also a double edged sword. If you have responsible uh, sponsors, responsible presenters, you get the correct information out. And if you have, sensationalizing like many TV channels, breaking news, most of it is all rubbish. So if we get to that sort of social media exposure, we are going to do much more harm than good. So I would use social media with care, with discrimination, and make sure that it is properly monitored to get, as you have, good panel of doctors and so on that to give correct information.
Thank you so much, Ms. Govil. You have rightly pointed out that we should have the right information from the right person and at the right time. So, what do you think are the other awareness methods apart from social media? That can help, or we can take leverage to increase the engagement and awareness for the
Well,
cancer.
I can list a few. Uh, I think the most effective is actually physical contacts, sitting with people, groups of people. It's laborious, it's time consuming, but there's nothing like it to sit face to face and answer all their queries, all their doubts, give them information, and allow them to assimilate it. We use it very effectively. We go into the slums, we go into the really the boondocks around Delhi, and we impart knowledge in this fashion. The second thing is to have awareness speakers who accompany the screening uh, groups. Like, we have a screening system that goes out, a mobile van and doctors which go out into the areas, and we always have an awareness speaker with them who is able to answer everybody's questions. The third thing I would say is to empower the health and welfare centers, the mohalla clinics, and let the GPs, the general practitioners, be trained in some of these common cancers. I mentioned diabetes and dialysis. In most cases, diabetes is taken extremely lightly. They don't, everyone says ha sugar ho gaya, but they continue eating their laddus and their jalebis and whatever else. If we can get through to them what happens with diabetes, it's not a matter of popping a pill. It is of general lifestyle, as Dr. Yuvaraja has already explained. It is looking after your well-being through certain measures, which may be additional exercise, which may be losing weight, which may be controlling your diet, various other things. I think the GPs and the health and wellness centers, the mohalla clinics, should be empowered to do that. In schools, we need to talk to children. It's surprising. We go and do awareness talks there. And during the tea break, the child will come up and say, ma'am, my father has this problem. My uncle has this problem. You get to the root of where it is coming from. And then it is easier to design media programs.
Yes,
Thank you.
thank you so much, Ms. Govil. You have very rightly explained the importance of physical awareness session. That you get to know them uh, better and get to know the root cause of the problem better when we do a physical awareness session. Yeah. So. With that, I would like to ask Dr. Talwar, sir. So, what is the prognosis for patients with renal cancer, and how does it this vary depending on the stage and subtype of the disease?
Thank you, madam. This is a very, very important question, which every patient and attendant comes and asks immediately once they enter the clinic that, doc, where do I stand? So, for that, there is an algorithm. So, what you do is you do the biopsy, you know the name of the disease, you do a scan of the tummy and of the chest to see the spread of the disease. And once you have the name of the disease by biopsy and the spread, then you come to the stage of the disease. Now, stage, shows you the way through the treatment highway in the sense that there are four stages, and depending upon the stage, you can chart out the treatment. So, stage one and stage two are known as the early stages. Stage 3 is a locally advanced stage, and stage 4 is the metastatic stage in which the disease has gone outside the parent organ. In this case, it would be the kidneys. So, if you have stage 1 or stage 2 disease, then we say that yes, in your case, surgery is the best option. Stage 3, again, we critically analyze that the disease is local and regional and it has not spread to the other parts of the body. Then we tell the patient that the patient can get surgery followed by some treatment which might be immunotherapy as per as the trials which are there nowadays. But when it comes to the stage 4 disease and we find that there are certain prognostic factors which are going against the patient, and in that situation we find that we give these patients, as I told you, uh, the targeted therapy or the immunotherapy or in combination. In some niche cases where we find that the factors are favorable and the patient is responding to the treatment, we might incorporate surgery. And the surgery can be of the primary organ, that is kidney, and sometimes it can be the other ones like the lungs. If you have two or three spots there, probably they also can be taken out. So the accent in stage 1, 2, and 3 is towards cure, and stage 4 is towards preservation of the quality of life, which definitely would translate into quantity of life at a later point of time. Thank you.
Thank you so much, Dr. Talwar, for elaborating all the stages and the prognosis in a very brief manner. So with that, I would like to conclude this session by taking a one-liner message from all the speakers. So, starting with Miss Govil.
In reverse order. Okay. One liner, know your body. That's it. Know your body. If you know your body, you will reach the doctor faster than any other way.
Yes, thank you so much, Miss Govil. Dr. Talwar.
Well, I would like to say that whenever there is a problem and it is not getting corrected by the conventional treatments or the investigations, one should always have a high index for suspicion and try to go to the bottom of it as soon as possible, as Madam Govil said, without wasting time, because in cancer, time is of criticality and you have to beat the cancer. You have to, get to the bottom of the situation and try to uh, take stock of it as much as possible.
Thank you so much, Dr. Talwar. Dr. Yuvaraja.
Yeah, hi. I think the the take home message will be eat healthy and be healthy. The second one, which I want to always suggest, is that So get yourself checked regularly, especially the whole body checkup, so that at least we can have a early diagnosis and early whatever the disease. So these are the two messages for all cancer. The patients, normal, healthy individual.
Thank you so much, Dr.
Thank
Yuvaraja.
you. Thank you.
Miss Urvashi, are you there?
Yeah, sorry, my connection had just dropped off. So yeah, I'm
So
here.
it's just the we are just ending this session, and if
Yeah.
there is any one-liner or two-liner message that you want to give to the audience.
Yeah, I mean, I think to the audience, really, it would, just be, and it's, I think, more for all of us who are working in this space as well, to, educate ourselves about kidney health and obviously kidney cancer being one important part of that. But I think kidney health overall and the very crucial role that it plays in our overall health and well-being. I think, to really raise our awareness levels and proactively get information about this. So yeah, I think that's all I would say.
Thank you so much, Ms. Urvashi. So with this, I would like to thank all the esteemed panelists for taking time for this critical panel discussion today. This discussion has been very informative and has provided very valuable insights into this issue. So thank you so much. Thank you so much, all.
Thank you.
Thank you.